Welcome to this educational video on uric acid nephropathy. In this video, we'll explore what this kidney disease is, what causes it, how it affects the body, and what can be done to treat and prevent it. Join us as we delve into the details of this important condition. Uric acid nephropathy arises from elevated levels of uric acid in the blood, a condition known as hyperuricemia. This hyperuricemia can result from several factors. Firstly, increased production of uric acid can occur due to genetic predispositions or conditions like myeloproliferative disorders. Certain cancers or tumor lysis syndrome, which breaks down cells rapidly and releases large amounts of purines, which are then converted into uric acid. Secondly, decreased excretion of uric acid by the kidneys can be caused by kidney disease dehydration, certain medications like diuretics, or conditions that impair the kidney's ability to filter and eliminate uric acid effectively. Thirdly, dietary factors play a role, as high consumption of purine-rich foods like red meat, organ meats, and seafood can contribute to elevated uric acid levels. Ultimately, the combination of these factors can lead to the formation of uric acid crystals that deposit within the kidneys, causing damage and dysfunction. The pathophysiology of uric acid nephropathy involves a sequence of events initiated by hyperuricemia. When uric acid levels are excessively high, uric acid crystals begin to precipitate out of solution, particularly in the acidic environment of the kidneys. These crystals then deposit within the renal tubules, the small tubes responsible for filtering waste and reabsorbing essential substances. The presence of uric acid crystals triggers inflammation and obstructs the tubules, impairing their ability to function properly. Over time, this chronic inflammation and obstruction lead to damage and scarring of the kidney tissue, a process known as fibrosis. The kidney's ability to filter waste products and maintain fluid and electrolyte balance is compromised. Acute kidney injury may occur due to sudden blockage of the tubules by uric acid crystals. Chronic uric acid nephropathy leads to a gradual decline in kidney function, potentially progressing to chronic kidney disease and eventual kidney failure if left untreated. Epidemiological data indicates that uric acid nephropathy is more prevalent in individuals with certain risk factors. These include males, older adults, and those with a family history of gout or kidney disease. Certain ethnic groups, such as Pacific Islanders and African Americans, also have a higher susceptibility. Medical conditions like obesity, diabetes, metabolic syndrome, hypertension, and cardiovascular disease are associated with an increased risk of hyperuricemia and uric acid nephropathy. Furthermore, individuals undergoing chemotherapy or radiation therapy for certain cancers are at higher risk due to tumor lysis syndrome. The overall prevalence of hyperuricemia varies depending on the population studied, but it is generally estimated to affect a significant proportion of adults worldwide. The incidence of uric acid nephropathy specifically is harder to determine as it often overlaps with other kidney conditions. The signs and symptoms of uric acid nephropathy can vary depending on the severity and duration of the condition. Some individuals may experience no noticeable symptoms in the early stages. As the condition progresses, symptoms may include flank pain, which is pain in the side or back, indicating kidney involvement. Hematuria, or blood in the urine, may also be present. Urinary frequency or urgency, as well as decreased urine output, can occur. In severe cases, symptoms of kidney failure may develop, such as swelling in the legs and ankles, fatigue, loss of appetite, nausea, and vomiting. Acute uric acid nephropathy, caused by rapid uric acid crystal formation, may present with sudden kidney injury and associated symptoms like decreased urine output and fluid retention. Diagnosing uric acid nephropathy involves a combination of clinical evaluation, laboratory tests, and imaging studies. A thorough medical history and physical examination are essential. Blood tests are performed to measure serum uric acid levels, creatinine levels, and other indicators of kidney function. Urinalysis is conducted to detect the presence of blood, protein, or uric acid crystals in the urine. Kidney function tests, such as glomerular filtration rate at GFR, are used to assess the overall function of the kidneys. Imaging studies, such as ultrasound or CT scans, may be performed to visualize the kidneys and identify any structural abnormalities or uric acid stones. In some cases, a kidney biopsy may be necessary to confirm the diagnosis and assess the extent of kidney damage. Uric acid nephropathy can be broadly classified into two types: acute and chronic. Acute uric acid nephropathy typically arises from a sudden increase in uric acid production, often associated with tumor lysis syndrome or certain medications. It is characterized by a rapid decline in kidney function. Chronic uric acid nephropathy, on the other hand, develops gradually over time due to prolonged hyperuricemia. This type is more insidious and may not be recognized until significant kidney damage has occurred. The treatment and management of uric acid nephropathy aim to lower uric acid levels, relieve symptoms, and prevent further kidney damage. Medications that reduce uric acid production, such as allopurinol and febuxostat, are commonly prescribed. Uricosuric medications, which increase uric acid excretion, such as probenecid, may also be used. Alkalinizing the urine with medications like sodium bicarbonate helps to dissolve uric acid crystals. Adequate hydration is crucial to flush out uric acid and prevent crystal formation. Dietary modifications, such as limiting purine, rich foods, and alcohol consumption are recommended. In cases of acute kidney injury or severe kidney dysfunction, dialysis may be necessary to remove waste products from the blood. Addressing underlying conditions, such as obesity, diabetes, and hypertension, is also important for managing uric acid nephropathy. Preventing uric acid nephropathy involves lifestyle modifications and medical management. Maintaining a healthy weight following a balanced diet low in purines, and staying adequately hydrated are crucial. Limiting alcohol consumption, especially beer and sugary drinks, is also recommended. Regular monitoring of uric acid levels is important, especially for individuals at high risk. Individuals taking medications that can increase uric acid levels should be closely monitored and potentially switched to alternative medications if possible. Early detection and treatment of hyperuricemia can help prevent the development of uric acid nephropathy and protect kidney function. The prognosis of uric acid nephropathy depends on the severity of kidney damage, the underlying cause, and the effectiveness of treatment. Early diagnosis and treatment can significantly improve the outcome and prevent progression to chronic kidney disease and kidney failure. However, if left untreated or if kidney damage is severe, uric acid nephropathy can lead to end-stage renal disease, requiring dialysis or kidney transplantation. Recent research focuses on identifying novel therapeutic targets and developing more effective treatments for hyperuricemia and uric acid nephropathy. Studies are exploring the role of inflammation and oxidative stress in the pathogenesis of the disease. Additionally, research is investigating new medications that can both lower uric acid levels and protect kidney function.